Today, both obesity and total hip replacements are rising at an alarming rate. At the time of making this video, 30% of UK adults are estimated to be obese, with this projected to increase to as much as 1 in every 2 women and 3 in every 5 men by 2050. In comparison, while 90,000 hip replacements were carried out in 2018, this is predicted to rise to almost 5 times that by 2035. And this isn't merely a coincidence, as research has shown a positive association between the two. Compared to someone of a normal BMI category, one study suggests that the odds of having the surgery shoot to around 3 times for class 1 obesity, 5 times for class 2, and even 9 times for class 3. But what are total hip replacements? Is it just the increased load placed on the hip from the excess body fat that heightens obese persons' risk for them? And are they more prone to complications of the surgery at the same time? Well, today we'll be discussing all this and more. But first, as always, please take note of our disclaimer. A total hip replacement, also called a total hip arthroplasty, is one of the 4 most common surgeries. It is regarded as one of orthopedics' most reliable, reproducible, successful, and cost-effective procedures. Put simply, it replaces the ball and socket joint in your hip with a prosthetic one. In relation to the other 3, partial hip replacements, known as partial hip hemiarthroplasty, contrarily removes the ball of your hip but not the socket. Hip resurfacing takes tissue from the surface of your hip and covers the head of your femur with a layer of metal. And hip arthroscopy is a minimally invasive procedure involving the surgeon making a small cut and inserting a tube called an arthroscope to have a look around and repair certain dysfunctions. This type of surgery presents advantages over typical open surgeries, since open surgery can cause more noticeable scarring, higher post-operative pain, swelling, and risk of infection, as well as more extended hospital stays and road to recovery. That's not to say that it's always better to have minimally invasive surgery though, as certain cases require open surgeries. Anyway, going back to the focus of this video, total hip replacements, the most common reason they're done is to tackle end-stage symptomatic hip osteoarthritis. Osteoarthritis, or OA, consists of 4 stages. Stage 1 is when the hip joint has minimal wear and tear, causing little to no pain, but growth spurs begin to form. The joint space is still relatively intact at this stage. Stage 2 is when the cartilage diminishes and growth spurs appear on x-rays. Symptoms at this stage are pain, stiffness, and discomfort in the hip, especially after a workout or a long day of being active. Stage 3 is when there is erosion of cartilage and the gap between your femur and pelvis narrows. In addition to the symptoms already noted worsening, swelling also arises. And finally, stage 4, aka the end and most severe stage of osteoarthritis, is when the cartilage has almost been completely worn away, which results in chronic inflammation and causes pain and stiffness to be felt all of the time. Now, it might be easy to deduce that weight gain simply enhances the likelihood of this stage and subsequently the risk of total hip replacements, since increased body fat stores places more load on the hip day by day. But on top of that, you must remember that fat tissue isn't passive energy storage, but is metabolically active, secreting several pro-inflammatory substances such as leptin, resistin, and adiponectin that have all been indicated to play a role in the degeneration of cartilage. Further, weight gain also changes your biomechanics too, which can make joints even narrower. Collectively, these are the main reasons obese persons are more prone to hip replacement surgery. This explains why weight loss is then considered a first-line treatment for all patients with symptomatic hip osteoarthritis. Alongside this, physiotherapy is too. One study by Pans et al. In 2013, combining both, found that following an 8-month program where patients with degenerative hip complaints lost a 5% reduction in their baseline weight, there was an improvement in pain by a quarter and in function by a third on average. Accordingly, if you are interested in undertaking our evidence-based and results-backed personalized plateau weight management program, please click the link in the top right-hand corner of the video or follow the link in the description. Other strategies for hip osteoarthritis include, but are not limited to, NSAIDs and corticosteroid injections. Nevertheless, despite the efficacy for many people managing hip OA through these conservative means, For others, they unfortunately won't be enough to slow down their progression to stage 4 or treat it once they get there. As a result, hip replacement surgery stands as a last resort when all else fails. Indeed, research has shown the benefits of the surgery for the concerned populations. For instance, a systematic review in 2018 by Bharat et al. On total hip replacements in morbidly obese patients demonstrated improvements in pain and quality of life comparable to patients with a normal BMI. But there are also downsides. Niehaus et al. In 2023 suggests that obese persons undertaking total hip replacements show a higher likelihood of infection, dislocation, and the surgery needing to be redone. The researchers also explained that the procedure takes longer and there's significantly more blood loss compared to those with a normal weight. Therefore, because everyone has different circumstances, if you are considering the surgery, it's essential to lay out all pros and cons of undertaking it together with your doctor to decide if this is the best course of action for you, and to ask yourself whether you've honestly done everything in your power to help manage the condition through non-operative strategies to avoid any potential complications altogether. What are your thoughts? We'd love to hear from you in the comment section down below. Additionally, if you're new here, make sure to like and subscribe to our channel. So that has been our video. Thanks for watching, and I'll see you next time.